The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Enhanced Community Quarantine, or ECQ, is extended in Metro Manila and 4 provinces for another week, as experts warn that as many as 12,000 COVID-19 cases per day can be expected in the coming days. The government looks to divert additional healthcare workers from other regions to Metro Manila hospitals overburdened with COVID-19 patients. And can the government still afford to hand out more aid or ayuda to those affected by the lockdown? Presidential spokesperson Roque joins us live. Metro Manila and 4 nearby provinces are spending another week under strict enhanced community quarantine. President Rodrigo Duterte approved the recommendation in order to stem the rapid rise of COVID-19 cases. On Sunday, health authorities logged 11,000 new cases. Experts warn of up to 12,000 new cases daily in the coming days. Let's go straight to the source of the story. We have presidential spokesperson Roque. Secretary Roque, good to have you back on the show. How are you, sir?
Good morning and happy Easter.
Happy Easter, Secretary. Let's start with the extended ECQ. Of course, I heard your announcement on this last Saturday. Can you first tell us what were the factors that were considered that led to the extension of the ECQ?
Well, it has always been based on a formula, no? That we look at the average daily attack rate as well as the 2-week average attack rate of in the different cities and one municipality of Metro Manila, together with the healthcare capacity. And right now, both the attack rates and the healthcare capacity are still at critical levels, no? And hence the decision to extend ECQ. But we're following a model, no? Prior to the ECQ that we imposed, we had a 1-week travel bubble in NCR Plus, and we're looking at another week of MECQ after this week, assuming our prevention, detection, isolation, and tracing strategies indeed work. No? So if the PDITR strategies work, at the end of the 2-week ECQ and another week of MECQ, we should be looking at around 4,000 cases daily. Of course, the additional ECQ was imperative in order to allow our health workers some breathing space, no? Because the sharp tracing cases, of course, also resulted in an increase, a tremendous increase in the number of moderate and serious cases that required hospitalization.
There were some portions, Secretary, I didn't quite hear. So we're looking at, ang sabi niyo nung Saturday, a minimum of 1 week. Ano po? What does government want to achieve considering this week, this extended week of ECQ, considering that if we look at the past 3 days of the infections, we were logging at over 10,000.
Well, what I said was in the model that our DOH experts are following, if we impose another week of ECQ in addition to the bubble and the 1 week of ECQ that we've had already, and if we were to impose another week of MECQ, we are looking at around 4,000 cases a day, no? Which is a tremendous reduction from the 12,000 that we have right now. No? And of course, because of the critical care capacity of all our hospitals, it was indispensable, no, that we give our hospitals a breathing space. And that's why there was a decision to impose another week of ECQ. But the estimate is after the 2 week of ECQ and another week of MECQ, we might be able to reduce the number of cases by around 4,000 a day.
But let's say this week of extension, how much do you think reduction in terms of numbers first of COVID positive of infections are you expecting to see?
Well, actually, we have if we just do 1 week of ECQ, then we would be only looking at we have different scenarios, no? And the scenario that I quoted of 4,658 is if we were to do an additional week of ECQ and then MECQ after, that's 4,658. No? But if we were to do ECQ and until April 11, And then GCQ, then the number would be substantially more, no?
Mhm.
I actually have it in another phone, no? But the numbers, if it's just another week of ECQ, would be easily double the 4,000. So it's indispensable that number one, during this period of ECQ, we intensify our prevention, detection,
Mhm.
isolation, treatment. Local governments for this purpose were given a scorecard of sorts to measure, no, to have a basis for self-assessment on the extent that they have implemented these PDITR strategies. Now, these PDITR strategies include the Ravi-like house-to-house search for symptomatics and subjecting them to testing as well as to isolation. And
Right,
of course,
antigen
because
testing.
intensified testing is part of the strategy, we have already authorized in the IATF the use of at least 500,000 antigen testing kits, three brands of which have already been validated by the RITM to complement our RT-PCR tests.
Okay, I want to go to that a little later on, Secretary. But first, this also, what would you say were the gains of government the past week, the first week of ECQ, if at all there were any?
Well, we're about to find out because the tangible results of the bubble takes 2 weeks. And in fact, the data that we will obtain from last Easter Sunday would be the first manifestation of how effective our travel bubble was, no, 2 weeks ago, no, because there's a waiting time of 2 weeks before we can see results. No? But I think the gains is number one, because we have limited the movement, definitely, I think starting this week, we will be registering lower numbers. And number two, because of the limited lockdown, we have also enabled our health capacity to improve. As in fact, today we are inaugurating 110 ICU bed capacity in what used to be the Quezon Institute. No? It still is the Quezon Institute, but it's now converted to an ICU facility for COVID cases. No? And in addition to that, we are about to inaugurate next month further 160-bed ICU capacity, no, in at least two existing hospitals. These are modular ICU bed capacities. No? So again, the decision to impose this lockdown is to enable us to improve our healthcare utilization rate, and we have done so.
And because you mentioned that, I wanted to talk to you about the hospital capacity. There have been, I'm sure you also read it and you hear about it, so many heartbreaking stories everywhere, whether it be through text, on Facebook, or even Twitter, families desperately looking for hospitals to take in their COVID positive loved ones. So you already mentioned that there will be additional 110 beds in the Quezon Institute. Ano po. Secretary, knowing that this is happening right now, hindi ho ba kulang yung 110 na idadagdag na bed capacity?
Well, kulang po yan, no? Kaya nga po there's been a decision already made by the DOH, no, that they will build modular ICU bed capacities, no. We have identified at least two sites to build these tents basically for ICU patients, no. One of which is in Taguig, property of GOCC Corporation, and then the other is in the PICC area, no, in the parking lot of PICC. No. There are modular ICU bed units that are readily available, and we are looking at constructing this. No. In addition, the DPWH continues to build modular facilities, no, utilizing container vans. No. So we are improving healthcare capacity by using technology. And we expect that in addition to the 110 today, we are estimating no less than 500 additional ICU bed capacity very soon.
Secretary, we just need to take a very short break. We will be right back. You're watching The Source on CNN Philippines. Our guest today, presidential spokesperson Harry Roque. So, sir, when we're talking still about hospital capacity, I wanted to share something that I look into in terms of the critical and severe. I know this is something we've talked about over and over again, but if we look at the numbers of about 0.6% critical and 0.6 severe, that may seem small, but if we are rounding out the number of about 10,000, that would be more or less, 100 maybe 110 severe and critical patients on a daily basis. I'm not sure if that would be the right way to compute this, but it seems to me that that would be an additional 110 cases every day at 10,000 of severe and critical patients. I just wonder how our hospitals will cope with numbers like that.
Well, in addition to the modular hospitals that we're building now, we're also relying now on telemedicine. No? There's quite a number of hospitals, both public and private, that have now opened web pages where patients can actually consult with physicians online, no? Knowing that there's not enough space, particularly for the mild cases, no, in our hospitals right now. No? We are also encouraging those who have mild or asymptomatic, who are asymptomatic, to avail of our temporary treatment facilities, because in the TMMFs where I stayed, we also have doctors monitoring the patients twice a day. No? So we are encouraging everyone, those who are not actually in serious conditions, to please avail of the TTMF's facilities. These are hotel facilities where we have medical personnel rather than going to hospitals.
And when it comes to healthcare workers, I'm sure you've heard that at the orthopedic center, there are over 100 COVID positive healthcare workers. Those are doctors, nurses, and possibly even technicians at that. What could happen to them? Because I saw a report that uh, nahihirapan ho sila kasi number one, the isolation facility at the hospital is only good for about less than 20. Some of them can't go home because nakadorm po sila and they share it with other people. Is there a plan, for example, for the healthcare workers at the Philippine Orthopedic Center?
Well, those who could not be accommodated in the isolation facilities of orthopedic have been accommodated in a TTMF facility, which is a hotel. No? I understand about 46 of them have already checked in into one of these TTMFs, no, nearest the orthopedic. No? So of course they are given priority, and in the TTMF's facilities, as I said, there's also medical facility, and these are actually 2 to 3 star hotels now, which are very comfortable. No? And all of those who tested positive in National Orthopedic have now been given a slot in an isolation facility, either on site or in a TTMF facility.
And
now,
that's free, no?
As far as health workers augmentation is concerned, we have learned from the past that one strategy that we need to implement is to recruit health workers from adjoining regions where the numbers of COVID are more manageable, and we're now doing that. No? We have increased our recruitment by around 60%, and this was the report of Yusek Vega as of last Saturday. No? In addition to that, Secretary Roque is now coordinating with the PMA to harness, no, the private doctors who may provide consultancy services also in the temporary treatment facilities at the very least, so that the specialists can concentrate on the severe and acute cases.
There is a suggestion from some sectors to publish hospital occupancy. The words are real time, because if you look into the stories and what is being told on social media, even reports, sabihin po natin, Secretary, 80 or 90% occupancy rate. I think the last was 90% occupancy rate in the hospitals. Yet you have patients, loved ones of families, going around every single hospital. They say 10, 11, 12 hospitals in NCR, and they can't seem to find a hospital na pwedeng ipasok yung kanilang loved one, yung kanilang miyembro ng pamilya. Help us understand the situation. Why is that so? When government says it's 90% occupied, there must be 10% where they can go. But it seems as it appears, wala na ho silang mapuntahan.
Well, that's why we have the one hospital command center. Before going to a hospital, my strong recommendation is call the hotline of the one hospital command center so that they will tell you where to go. Unless you call the one hospital command center, then you would have to go from hospital to hospital looking for a slot. Now, I'd like to highlight that the problem right now is that, particularly as far as private hospitals are concerned, they have allotted only 20% of their capacity to COVID patients. And government hospitals have allotted 50% of their capacity to COVID patients. No? So the slots for COVID patients are really limited, especially if you go to a private hospital. So my very strong recommendation, call the one hospital command center so that they can tell you where to go, because going from hospital to hospital simply will not be good for the patient.
But
Call the one
Secretary,
hospital.
nadagdagan na ho ba yung tao doon? Because I remember Yusek Vega saying that on an average of what, maybe 70 calls a day, and this was about 5 days ago, that's increased to about 400 plus. And people can't seem to call it, or they are on standby for such a long period of time. Would you have any idea if there is additional manpower or even lines in the one hospital command that have been established?
I was instrumental actually in increasing the telephone lines to the one hospital command center. If you will remember, one of my
I
press
do.
meetings called the telecoms provider. No, is if we need to contact the telecoms provider again for more lines, we will do it. No? But as far as manpower is concerned, I don't think we have a problem with manpower. No, because we're harnessing the entire bureaucracy of government for this purpose. No, and even the private sector, because these are manned actually by private call center operators. No. So if the problem is additional telecom facilities, we will make arrangements again to increase the number of lines, no? So that anyone can access the one hospital command center.
You did that the last time, I do remember. During your press conference, that very moment, you called on the Pangilinan Group and the Ayala Group to add more hospital lines doon po sa One Hospital Command, because that was one of the challenges of Undersecretary Vega. But I think, sir, he also mentioned that human resource is also a challenge for them.
We'll look into that because I know we're utilizing private call centers, operators for this purpose, no, who are experienced in dealing with this line of business. No? But I will check with Yusek Vega what else he needs so that the palace can give the necessary assistance.
Okay, just one more thing on the one more issue on the healthcare workers. Or I know you said that those coming from the less where siguro the cases are very low, we can expect augmentation from them. I think si Senator Bongo also said that some healthcare workers from the Visayas will be coming to the to NCR. My question is, do you know how many healthcare workers from the provinces will augment the human resource here in NCR, and when?
I don't know the exact number, but last Saturday we had a special meeting precisely with Executive Secretary and Senator Bongo, no, outside of the IATF meeting. And that was where Yusek Vega said that they were able to hire 60% of their target personnel. So I will get the actual numbers, but the percentage is what I remember from what Yusek Vega said. And this is a rather good recruitment process, no, of hiring 60% of the required number. Now, the 60% I think are even full-time plantilla positions. No? So I'm not sure about how many he has been able to recruit for temporary positions. I will find out.
Positivity rate is at 23, sometimes 24%. That means 1 out of 4 individuals who are tested end up being positive. I know you mentioned a while ago that antigen tests, 500,000 of those have been purchased by government to augment the testing of government. But I was looking at the data in the past couple of days. I know sinabi ni Secretary Vince Dizon that we're at almost 50,000 tests a day. But when you talk to experts, they say what we really need to do, especially with a 1 out of 4 positive infection, we should be testing about 100,000. Is this possible?
Well, that's what we're trying to do. No? If not 100,000, we need to jack it up by at least 90,000. No? And in addition to the use of antigen tests in the last IATF meeting, an appeal was already made to RITM to validate as quickly as possible the saliva PCR test, because the saliva PCR test is half in cost at least, no, to the normal PCR test. And what we're aiming, of course, is to double the number of PCR tests that we're conducting. And because if it was half as expensive as the normal PCR, then we can do 100,000 PCR tests instead of the current 50, no? In addition to antigen tests.
And in fact, pinayagan na po yan ng government, pinayagan na rin po ng FDA, but so far it's the Philippine Red Cross doing the saliva testing. All right, we're going to talk about government's ayuda. Will they expect another round after this almost 30 billion pesos released by government? We'll be taking another short break. The source will be right back. You're watching The Source on CNN Philippines. Our guest today, Presidential Spokesperson Harry Roque. I wanted to add this lang, Secretary, yung pong tent, para lang we're very clear on this, na sinasabi nga, kailangan bayaran ng 1,000 per hour at hindi pasok sa PhilHealth. Just for, again, clarification, what is the government's stand on this?
It should be covered because the tents are preparatory to admission. And of course, as soon as they check in the tent, they're actually under the supervision of the hospital level. So I do not know who said that it should not be covered, but of course, we will clarify this matter with PhilHealth.
But that's already the directive of government. Kailangan po covered na siya.
Kailangan covered na po siya because the tents are temporary waiting facilities prior to actually being given a bed, but they're already being given treatment by the tents.
So now we go to the government's assistance, yung pong ayuda. Supposed to be, ida-download na ho ito sa mga LGU today. So it's clear, 1,000 or a maximum of 4,000 per family. Yung pong, is there a directive from government on when or a deadline by which LGU should be able to distribute this to their constituents?
Well, of course, government wants it distributed as soon as possible. Initially, it was supposed to be given in kind, no? But the president thought it would take too much time. That's why we became silent on how it was going to be distributed. It can be done in cash or in kind. But I think the growing consensus, at least amongst Metro Manila mayors, is that they will give it in kind. But the president just wanted the local government officials to have some leeway, no? If they have readily available goods, then why not, no? If that is the fastest way. But right now, I understand that many of them will just give cash. Now, the idea is to give the cash this week because we understand that this is already the second week of ECQ. But one thing going for us is the ECQ last week coincided with Holy Week, where the workers only lost about 2 to 3 days of working days.
Right. So now begs the next question. Magkakaroon ho kaya ng additional ayuda dahil nga nag-extend na naman tayo ng 1 week of ECQ? Is the government even considering it?
Government, when we distributed or when it was decided to distribute 4,000 per family, considered already that the ECQ would be for 2 weeks. And the reason is, of course, during Holy Week, they only lost 2 days of working days effectively. So we believe that although it's never enough, this will tie over our countrymen for this additional ECQ. And that is also a consideration on whether or not there will be a 3rd week of ECQ. Now, Secretary Wendell has said that under the existing budget, we have no further source for ayuda. But if there is need for further ayuda, then Congress would have to be called into a special session because it is into a recess, and we would need to get a supplemental budget for that purpose. But for the time being, it will be the 23 billion released already will be the totality of ayuda that the people will get.
There is a tweet from Senator Ping Lacson. I'd like to ask for your reaction, if you will. The coronavirus has gone berserk while it is on at-will mode. We are like on autopilot. We can't feel someone is in charge. Sobrang malas. We have repeatedly urged the president to change the crew or at least the captain, even pass a resolution in this regard. Just a reaction on that. And is there any chance or any consideration for the president to adjust or change some members, possibly of the IATF, or will it remain as is?
You know, Pinky, what's clear is until February 22, we have effectively managed COVID-19 in this country. And of course, all the scientists will confirm that what happened is that we're now dealing with a virus which is different from the virus that we saw in March. The B111 is a different virus already. It has mutated and it has become more virulent and more infectious. So what I'm saying is until the virus mutated, we managed it very well. We were number 30 worldwide. We are still number 30 worldwide. which only proves to show that all other countries in the world are facing the same predicament. No? The virus having mutated and having become more infectious. In fact, we're not the only country under lockdown right now. There's at least 10 other countries that have also locked down as a result of the increased infectiousness of these new variants. No? So I think, to be fair, we have employed the entire government approach. It's the entire COVID response is not dependent on the Secretary of Health. It is dependent on all the cabinet secretaries, including the DOH, and under the leadership of the DOH, in close coordination also with the WHO.
Just one issue I wanted to raise.
Hello?
Yes, Secretary, one last issue. I have 1 minute left. This exchange between Defense Secretary Delphine Lorenzana and the Chinese ambassador on the issue.
I can't hear you. It's garbled now. This is the problem. The internet becomes slow.
Secretary, is this? Let me try again. Can you hear me better now?
I can't hear you. Please repeat the question.
Okay, yung pong exchange between SND and the Chinese ambassador regarding these 40 Chinese militias at the Julian Felipe Reef. I just want to ask you, meron ho bang plano si Pangulong Rodrigo? I know that, let me just add, sir, si Secretary Locsin says he may consider a démarche to issue a démarche protest. So does the president, or is the president planning to call the Chinese ambassador again to discuss this issue?
Well, the again is probably not the accurate term, because the first time they met, it was a social call. And the president there incidentally brought up the issue of the fishing vessels. Now, the status right now is under the qualified political doctrine. Of course, the president stands by the statements of our Secretary of Defense. But I hasten to add that the president has been clear that this is not an issue that will lead to war between friendly nations. And we're hoping that our friendly relations will soon resolve this latest impasse.
Okay, we've run out of time. Presidential Spokesperson Harry Roque, sir, maraming salamat po sa inyong oras.
Maraming salamat, and it's always a pleasure. Good morning.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.